Hi, my name is Monica Aggarwal. I'm a cardiologist. I have changed my practice of cardiology so much in the last 5 or 7 years, and I want to tell you a little bit about why, and I want to tell you a little bit about my story. I would tell you that the road to becoming a female cardiologist was long and difficult, and I postponed a lot of things, and felt like I had to work harder than everyone else because all my counterparts were male, and I had something I felt like I always had to prove. And I really felt like I had achieved a lot of success when I became a cardiologist 10 years ago and was at the top of my game. I was working hard, I was married, I started having children, which was the greatest blessing of my life, and I was doing really well. But because I decided to have a career first and then children, I felt I had to have kids sort of in rapid succession, and so I did. I started having children every 2 years, and I wanted to have 3, so at one point I had 3 kids under 4 years old, plus a full-time job, and life was extremely tiring and exhausting. After I had my 3rd child, though, life started changing for me. And at the time, I was working all day. I'd come home, I'd nurse the baby, spend time with all 3 children. I'd sleep 3 or 4 hours a night, and then I would start over and do it again. And I figured, you can do that, because I could do that, and I would just sacrifice sleep, and it was worth it because I was going to keep everything together. And about 4 months after I delivered my 3rd child, I realized that that wasn't going to happen. I started having this migratory joint pain. It started in an elbow, and then I remember my 2nd finger started swelling and getting red, and it was extremely painful, and it would be there for a couple days, and then it would move to the next joint. And I remember over a 2-week period, then it was my right shoulder, then it was my left knee, and I wasn't able to run, and I was an avid runner. I was unable to run. I was unable to do some of my daily activities, and I started noticing I couldn't button my kids' clothes. The little snaps on the baby clothes, I couldn't snap them, and that surprised me. So I thought I had Lyme disease, so I started myself on antibiotics for Lyme disease because I'm a hiker. I thought I must have picked up a tick bite. I remember one day, 2 weeks after this pain started happening, I had come down, it was 5 o'clock in the morning, I'd come downstairs to do breakfast, and the baby started crying. And I remember getting out of bed that morning was extremely painful. I felt like there was ice or glass shooting through my feet. Every step was like fire. But I started hobbling down the stairs, and I went down, and I was making my breakfast. And when the baby started crying, I wanted to run up the stairs because I didn't want anyone else in the house to wake up. But I couldn't do it. And I remember that I started trying to run, but I just couldn't even lift up my knees to make the steps. And suffice to say, I ended up crawling up the stairs that day. I remember the tears. I remember the pain, the excruciating pain as I tried to climb up the stairs. I remember trying to pick up the baby out of the crib and not being able to do it. And that was at that moment that I realized that I was in big trouble. So I started doing blood work on myself, and I found out that I had rheumatoid arthritis. And prognostically, looking at my markers, the rheumatologist I saw said I had a very debilitating form of rheumatoid arthritis. I was fairly confident that I wouldn't practice medicine. I wouldn't be able to do procedures, and frankly, with that moment how I felt, I wasn't even sure I'd be able to be a good parent because I couldn't even do the snaps on my kids' clothes, and I was really scared. I remember that I've never been so scared in my life as I was at that moment. The rheumatologist told me that I had to stop nursing the baby immediately, that I had to get on high doses of medications within a week. Otherwise, he wasn't sure how well I was going to do because it was such a debilitating form of rheumatoid. So I did. I stopped nursing the baby. I remember the pain and sadness I felt and the guilt I felt to this day about stopping nursing that baby. I remember the anger I had having had a third child, and why I was pushing it, and why I had done all these things, and why did I feel like I should have had a third kid when, why didn't I just stop at 2? And I remember being angry at my kid and my poor little girl, because if I hadn't had that third kid, maybe I wouldn't have developed rheumatoid. But I did. I had it. In a week after I was diagnosed, I was on highly toxic medications. I felt terrible. My hair started falling out. But my joints got better. It took about 2 weeks, I think, after starting medication that I started getting better. I stayed on the medications for months, feeling lousy in terms of nausea from the weekly medications. But joints were working, so I was able to go back to work. I was able to practice medicine. A few months after maybe even 6 months after I started medicine, I met a nutritionist who recommended, she wanted to be part of my heart fair. And I said, sure, I thought about it. I was a little bit in debate if I was going to include her in the fair. And she said, well, let me just do your profile. Let me do your nutrition profile. And I was a runner, I was an active person, I was fairly slim. I thought, there's nothing that needs to be done. But I let her do my profile. And I told her about my illness, and she said, look, I think I can help you. And that started the path to me understanding for the first time what nutrition and diet can do to your body. So 3 years ago, 3.5 years ago, I was diagnosed with rheumatoid arthritis. About 6 months ago, I believe through my diet, I came off medication. I did a triathlon. I do yoga a couple times a week. I'm a runner. And I realized from what that nutritionist taught me, she started me on this path to learning about nutrition. And I've spent 3 years teaching myself how to be healthy and how to use diet to calm inflammation, and how there's so much in our day-to-day that we do that is toxic to our body. And I have read and I have researched, and I believe in my heart and in my joints and in my soul that diet can play an active role in inflammation. You can use diet to decrease inflammation, and you can treat disease with diet.